Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters. Tonight we have Dr. Shabeer Jeewa, who is a child and adult psychiatrist who's been in the field for many years and has a list of publications to his name. He's practiced in Canada and he's currently practicing here in Johannesburg. His area of expertise is ADHD in children and in adults. But before we welcome Dr. Jeewa, I would like to begin with the tarbiyah, which is customary. Bismillahir Rahmanir Rahim. The noble messenger of Allah, Muhammad, peace be upon him, is reported to have said, quote, "No one of you is a believer until he loves for his brother that which he loves for himself." This is from Hadith Bukhari and Muslim. There is an incident about a little girl named Amina who was suffering from a rare and serious disease. Her only chance of recovery appeared to be a blood transfusion from her 5-year-old brother Abdullah, who had miraculously survived the same disease and had developed the antibodies needed to combat the illness. The doctor explained the situation to her little brother Abdullah carefully and asked the little boy if he would be willing to give his blood to his sister Amina, who needed it urgently to survive. Abdullah hesitated for only a moment before taking a deep breath and saying, "Yes, I'll do it, if it will save her." As the transfusion progressed, he lay in bed next to his sister and smiled, seeing that when the blood was given, color was returning to Amina's cheeks. After some time, Abdullah's face grew pale and his smile faded. Then Abdullah looked up at the doctor and asked with a trembling voice, "Will I start to die right away?" Being young, the little boy had misunderstood the doctor. He thought he was going to have to give his sister Amina all of his blood in order to save her life. This is the ultimate in self-sacrifice, where a person is willing to give his life. Daily, we all face a challenge. To what extent will we give? If we cannot give the ultimate, then let us at least do whatever little we can do to bring about joy or benefit to others. Value and appreciate the people who sacrifice something for you, as maybe as their something was their everything. Never will you attain righteousness until you spend from that which you love, and whatever you spend, indeed, Allah is knowing of it. Sadaqallahu Azim. I'd like to take this opportunity now to welcome Dr. Shabeer Jeewa, who will recap on childhood ADHD and adulthood ADHD, which was discussed in a previous session on health matters.
Assalamu alaikum.
Walaikum salam.
Thank you very much. We covered what we covered last time. I'll just go through it very fast. We said that ADHD is a neurobiological condition, highly genetic, caused by the parents, more than likely through the genes. It's made up of a cluster of 3 symptoms. The first symptom, you can use impulsivity, where they get angry, and the kids get very impulsive, where they do things without thinking. The adults, they have road rage, they get anger, they get frustration, and they're fighting with their bosses, and they're fighting with their spouses. And the next symptom is activity, where in children moving a lot, that everybody knows about. And the newest symptom is talking too much, hyperactivity. In girls is hyperverbalization, is the same thing. That goes on to adulthood also. And lastly, the one that is missed a lot, that I'm going to focus a lot on today, is the inattentive type, or the dreamy type, or the lazy looking type. These are usually more in girls than in boys. And there's a title of a book saying, "You mean I'm not lazy, crazy, or stupid?" And so many parents call these adolescents or these kids is lazy, stupid, and just leave them in the back of the class, and they might have inattentive ADHD, and that's where we're going to go on from today. So there's been various thoughts about ADHD over the years. Can we have the first slide there, please? Yeah. So ADHD costs billions of dollars in losses and in expenses throughout the world. The amount of money it costs in the States, you can take all that money, billions of dollars, and you can buy the whole of Mauritius, I think. That's how much it costs, billions and billions of dollars. And you can see that how it impacts various areas of your life. 32% of the kids don't finish school, there's 35% dropout, and whenever there's a child that's so-called naughty or expelled, look for ADHD. And at the same time, they'll have difficulty getting good jobs. You can see from on the screen, they have a problem with substance abuse. There's a higher risk in ADHD kids that are not treated. Actually, the stimulants, including Ritalin, protects these kids from becoming druggies. If you have if you are ADHD and you are not treated, the risk of becoming a druggie is 75%. If you are non-ADHD, the risk is 18%. But if you treat these ADHD kids with stimulants, including Ritalin that you don't like, the risk drops from 75% to 25%. It's nearly as close as normal controls. So actually, the stimulants protect the kids from becoming future druggies. So do not be afraid. They are very safe. The drug is as old as 1930. We're not selling Ritalin today. We're selling ADHD that you must diagnose and you must treat.
Dr. Jeewa, that's interesting. You say it will prevent them from becoming druggies. How do you associate the risk of drug addiction with Ritalin? What is it that Ritalin does to protect children from becoming addicted to substances?
Well, the thing is, ADHD, there's a low level of two chemicals, the dopamine and the norepinephrine. Dopamine is for focus, and the norepinephrine is for impulsivity. So attention deficit means there's no focus, there's not enough dopamine, so you've got to find dopamine somewhere. And hyperactivity disorder, the second part of the name, there's impulsive and hyperactivity, there's not enough norepinephrine. So the Ritalin or the stimulants, whichever kind, in the States we have amphetamines, in South Africa we have Concerta, Ritalin, which is the same salt but different release mechanism. They protect or they prevent the reuptake or the loss of your own natural dopamine and your own natural norepinephrine. So if you block the loss of your own natural dopamine and norepinephrine, you have enough dopamine and norepinephrine so you can focus enough and you can not get so angry and you can control yourself. If you don't have enough dopamine and norepinephrine, then you have to do various things. You can do holistic treatment, which we talked about the last time, exercise, good sleep, meditation, prayer, good diet, and then on the other side, if that's not enough, then you need your medication. It prevents the loss or the reuptake of your own natural dopamine norepinephrine. It doesn't harm you in any way.
Now, we know that there's lots of myths and misconceptions and misperceptions around ADHD. Perhaps you can share or enlighten the viewers on the myths around ADHD.
Yeah, we can get the next slide there. Okay. Well, most people think that ADHD isn't a real medical disorder. Actually, 2 years ago, they found two genes, DRD4, and they found genes in USA and in Wales, where in future we will have a test in our office in about 1.5 years' time where we can find these genes or we can pick up these genes, and so that's how we can diagnose it. So it's a real medical condition that has a chemical imbalance. Further, these children need special accommodations. It's not unfair for them because some of them are slow, not IQ, but slow in speed. So they need to either sit in the front and middle, which most teachers agree, and they need 20 to 25% more time for exams, tests, and projects. The other things about the myths that was there, that it is more common in boys than in girls. It only affects boys. No, it affects both sexes, and either sex can be either kind of ADHD. There's 3 types of ADHD. There's the ADHD, the inattentive type, which is the old ADD, which is 23% of the kids. ADHD, the hyperactive impulsive type that everybody knows. It's only about 15% of the kids. And the highest percentage is the combined type. 64% is ADHD, the combined type. So it affects both sexes. You would find more boys than girls. In the younger age group, you'll have more boys. As they get older, they'll equal out. By adulthood, the hyperactive symptoms of adults get less, children get less, the impulsivity gets less, but by the time they reach university, the inattention gets worse. So time management, organization, procrastination, financial management, anxiety and depression, all that gets worse around 20 when you're at university and you crash. So the girls type that are more dreamy will get worse around university when they want to get married. The boys get a lot of trouble at school, but they get better by the time they get to university and they suddenly say it is outgrown it. You don't outgrow the condition, the symptoms change. And there's on the slide, and it's not caused by bad parenting, but it's caused by genes which is transmitted through the parenting, to the parents. And we've also talked already about substance abuse. So we can go on to the next slide. Yeah, so this is the first one. We've summarized this. This is impulsivity, where you can see in children they blurt out answers. In adults they drive fast, they get angry very quickly. Impulsive changes of activities of jobs. So driving too fast and getting traffic accidents is just not bad luck. There might be some ADHD and anger, which is in our grandparents and in our husbands, beating their spouses and all that. You should look for ADHD. It's not something that's only in the naughty kids at school. Can we go to the next slide? The next symptom of hyperactivity. Here everybody knows the kids running around. Then the main symptom in this slide is on the left side at the bottom, talking too much. So talking too much in kids and going on to the adult side is hyperactivity also. So it's a very important symptom. And in adults they're very restless, agitated, and they're always overscheduling themselves, got too many appointments. And the last one, the last symptom, this is the one that's missed mainly by parents and teachers and doctors. This is the dreamy symptoms or the inattentive symptoms. So the kids look like they're not listening, they don't finish their work, they easily get distracted, they forget their things at home, they forget their books in school, they forget the textbook at school. Mom is always going to rush. In the adult world, they have difficulty with reading and writing, and the main thing is time management, organization, procrastination, financial management. And pills won't treat that. You need coaching.
Okay. So what you've described is often undiagnosed. Parents will likely or are likely to say that their child is naughty, the child has forgotten his homework, has lost his textbooks, lost the blazer, and gets into fights at school. So the child is often left or misdiagnosed and is not treated properly, and of course that can contribute to other problems.
Definitely. The thing is, if it happens repeatedly, if it's an impairment, if mom always has to rush to school, or the teachers are always complaining, if it's repeatedly happening, then there's impairment. And you've got to go in and fix it up. Because in children, there's 3 areas of impairment. At school, which we just talked about, and fighting with the siblings at home, and not having enough friends. These are the 3 things in ADHD. If there's impairment, if it repeatedly happens, then it becomes a disorder, not an impairment. You have to treat it. In adult, it affects 3 areas also. Their marriage, their work life, fighting with everybody, and socially, not being popular in the community. So both of these, if there's impairment causing problems, then it becomes a disorder, then you have to treat.
But you've alluded to something very important. You mentioned coaching, the use of coaching and the benefits of coaching. Perhaps you can share that with the viewers.
Yeah, we've got some excellent slides later on, movie clips on coaching. And coaches, they teach you about time management, organization, life skills. The medication that you take only helps you focus. The pills does not help you to multiply or divide or to be on time. I saw a coach this morning, and I'm always late for work. So if I'm taking my medication, I can't be on time. You need coaching also. You need exercise, you need meditation, you need prayer, you need healthy foods, keeping away from stimulating food. But coaching is very important because they teach you life skills. It keeps these teenagers and adults on track. And it keeps you away from getting off track, getting into substances. Because as you get older, and if you don't treat ADHD, it's a very cruel condition if you don't teach it. These kids have a lot of problems in school and in families. We'll show you a few movie clips, what happens when they have concurrent learning difficulty, what difficulty they have with homework, and all these things. So there's a lot of problems, and this can be treated. And if your child is repeatedly having a problem, or your child is different from the other kids in your family or other kids at school, then you should check for ADHD. The typical class clown is an ADHD active type. The typical girl that is lazy, crazy, put in the back of the class, that's most likely inattentive ADHD. So we have to look for these things. There is treatment. It's the only child psychiatric condition that can be readily and easily treated. Unfortunately, only 50% of the kids are picked up, and about 75% of them are treated, and 50% adequately, and 90% of the adults are not diagnosed. Only 10% are diagnosed and treated. So majority of the adults are around there in trouble, either at work or in the marriages or in the substance abuse center or different places. So there is treatment, and let's look at the pain, because if you don't, you get into depression, you get into bipolar disorder, you get into substance abuse, which is a big, big problem, and lastly, you can get into jail and antisocial things. So it's a big, expensive problem that can be treated. And Indians is very high, it's second highest in the world.
So what Dr. Jeewa is saying is that it's not only disruptive, but it can be destructive. And on that note, we'll take an ad break, and please stay tuned. On our return, we'll continue with ADHD in children and adults. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. We have our guest in studio tonight is Dr. Shabeer Jeewa, and we will continue with ADHD in children and adults. Dr. Jeewa, you mentioned something about video clippings that you felt was valuable.
Yeah, 50% of these children have learning difficulty, and we want to show you how the kids struggle with the parents at home, which you know yourself, and also how they struggle with the teachers. And the main thing in these two clips, look at the self-esteem. If you continue sending these kids to school and doing homework without treatment, it looks like it's criminal, because with treatment they can do very well. Without treatment, you can see, just think about the self-esteem of this little Indian boy, Ashan, in the movie you might know. Go ahead with the first video, please. Here they're doing homework, his brother's in the background.
हो गया? देखो। क्या handwriting है? ये क्या है ईशान? सब स्पेलिंग गलत है तुम्हारे। यहाँ पे टेबल TABL और यहाँ पे TABEL और ये क्या है? THE द की जगह सिर्फ D। क्या है ये? कितनी बार ईशान? कितनी बार? अभी कल ही हम लोगों ने किया है। इतनी जल्दी कैसे भूल सकते हो तुम? बहुत मस्ती हो गई, फिर उसी क्लास में रह जाओगे। तुम्हारे सारे दोस्त अगली स्टैंडर्ड में चले जाएंगे। कांति, रोहन, अच्छा लगेगा तुम्हें? कॉन्सेंट्रेट बेटा, कॉन्सेंट्रेट। बकवास बंद करो और स्पेलिंग ठीक करो। नहीं, क्या? नो नो नो, ईशान, ईशान।
Okay, you can continue.
Yeah. So in this clip, you can see this is a successful family with a brother sitting in the background that gets 6 A's, and this little boy's got inattentive ADHD, the dreamy type, and he also has dyslexia. He can't read. And mom tells him, "We did the homework yesterday. You forgot. You're mixing D's and B's. His handwriting is poor, and he writes according to the way he thinks, and he has dyslexia." And the main thing is that when she pushes him, he gets very oppositional. He says, "No, no, no." 70% of these kids have oppositional defiant disorder, where they develop temper, belligerency, and anger and frustration, and you just feel like giving them one shot. And the child that you nurse and love all your life, when you feel like knocking them, that's called opposition defiant disorder, and it's a big part of the treatment that is missed, and this is the reason they're expelled from school mainly. And the teachers also miss the diagnosis of the learning difficulty. Now we'll show you a teacher that in the 38 week of learning, the teacher doesn't know that this child has dyslexia, reading difficulty. Let's have the next video, please.
Class, turn to page 38, chapter 4, paragraph 3. We're going to mark adjectives today. That goes for you as well, Ishan Agasti. Page 38, chapter 4, paragraph 3. Can I have your attention, Ishan? Ishan! I said page 38, chapter 4, paragraph 3. Read the first sentence and point out the adjectives. Page 38, Ishan. Aditya, just help the boy. Come on, the rest of you, look into your books. Read the first sentence and tell me what the adjectives are. Okay, come on. Let's all mark the adjectives together. Just read the sentence for me. Just read the sentence, Ishan.
ये तो नाच रहे।
Silence. Speak in English.
The letters are dancing.
They're dancing, are they? Okay, then read the dancing letters. Trying to be funny? Read the sentence loud and proper. I said loud and proper, Ishan. Loud and proper. Loud and proper. Stop it. Enough is enough. Get out. Get out of my class. Out.
So it's a 38 weeks, he's 38 weeks in class, about 6 months, and teacher doesn't know he has reading difficulty. And look at the self-esteem. She throws this child out, all the kids are laughing at him. And if you have a child like this and you don't consider psychoeducational testing and treating the child, then it's just not right. I mean, you have it's something on your conscience. You have to treat this child. For self-esteem is the earliest and the main reason why these kids have to be treated. You can have a very high IQ that most ADHD kids have, but if they have problems, as the Hellebel says, Ferrari brain, bicycle brakes, they're going to get into trouble and they're going to fail. And he'll say, Mommy, I'm stupid. And you say, no, but you have a high IQ, you got 140. 140 means nothing to a boy that says, I failed, I'm stupid, right? So self-esteem is the main thing.
So Dr. Jeewa, you're touching on something very important. You're talking about children who are often labeled as bad or mad, and actually beneath that there's usually a very sad child because the child is not being diagnosed properly and it's not being identified where the problem lies with the child.
Yes, unfortunately there's our whole system, and at home we think they'll outgrow it. The teachers tell the parents, well, she's just lazy, I'll put in the back of the class, he's naughty, I'll use a stick. But what about ADHD? You don't outgrow it. It goes right up to adulthood. 70% goes to adulthood, 84% develop other things, other comorbidity. So we have to diagnose these kids, we have to treat them. There is treatment. You just can't leave them in the back of the kitchen and hide them away and say he's different. No, he's special. You can bring out the greatness of this child if you fix the brakes. You can see the Ferrari. So don't look at the accidents, look at what car it is.
So what you're saying is also, again, I think critical. You're talking about the oppositional defiant child, and that child is being labeled as naughty or just belligerent. And if that is not addressed in time, the child could develop into a conduct disorder, and then we're looking at antisocial personality disorder.
Yes, definitely. As I said, there are three kinds. Can you put the next slide on? I said there are 3 kinds of ADHD, and 50% will have learning difficulty. So you can see here on the left side the inattentive symptoms, the right side impulsivity and overactivity, if you see the slide. And there's 3 kinds of ADHD. The inattentive type is the old-fashioned ADD. Hyperactive impulsive is the one that everybody's worried about. The most common is the bottom one, the combined type. So go to the next slide, please. So with age, you can see the impulsivity gets less, the hyperactivity gets less by 20, and they have a lot of trouble at school during those days, and we have to treat it. But by the time they hit university at 20 or 19, the top one, the inattention, doesn't get better, it gets worse. But the inattention are soft symptoms. So they get worse when you go to university or college or when you get married, if you get married young, which is, I said again, time management, organization, procrastination, financial management, anxiety and depression. So you lose a marriage, you lose a job, you lose your studying at school, all the things that are soft that makes you not appear that you're not working hard. And it's actually ADHD. 40% of the university first year dropouts are ADHD, undiagnosed and untreated. Let's go on to the next slide. So they end up here. I showed you on the left side there are 3 types of ADHD. On the right side, 50% end up with learning difficulty, like you saw the little boy, reading, writing, spelling. And on the left side at the bottom, opposition defiant disorder. 70% of these kids have anger, they're impulsive, they're stubborn, they get expelled from school, they swear, they fight, they do all the things that you don't like and you call them naughty. And lastly, if you don't treat them rightfully, you said they end up in conduct disorder, which is lying, stealing, fighting, drugs, alcohol, and all the stuff that you don't want. And it can be treated. So why get on and leave them till they finally fall in a deep hole? Treat them when they're young.
So what advice would you give to parents, firstly to parents, and then advice to educators out there? Because often we find that children spend more than 70% of their lives at school.
Okay, we need to develop a relationship between the doctors like us and the parents and the educators, the teachers in my days. So the teachers should not tell your child about ADHD. The teacher should tell your child he's different and he's having difficulty in some subjects, can we have him assessed. As a parent, the first thing you'll be defensive. No, my child cannot be like that because I'm successful. I'm a good businessman like that, Eshan's father. But listen to the teacher. Look at why is he different. Let's find out why is he different from our other siblings. Why is he different from other kids? How are his marks? And if they say that he should need an assessment, don't be afraid of an assessment. That would be the biggest break in your life. Get an assessment. The assessment will show what is wrong, and there is treatment for everything. There's no treatment for suicide and death and getting them out of jail eventually, but there is treatment when you treat them early. So why end them in a hole? Why do you get them into trouble later on? Let's fix it very early. The earlier you treat, the less trouble they'll get into. The later you treat, they get into all sorts of trouble. And then we'll show how important is it to get treatment early and what good treatment we have. So let's go on to the next video clip, please.
Attention deficit disorder.
It can be devastating.
Adult attention deficit disorder.
Without a proper diagnosis, ADD can ruin your life. It's sort of like having a Ferrari engine for a brain. But there is one problem. You have Model T brakes. The most common reason an adult comes to see me is that they're underachieving. Flashes of brilliance, but then periods of completely blowing it. And they don't understand it. For the life of them, they keep trying and trying and trying, but they get these inconsistent results. So unexplained underachievement, not only in work, but in relationships. Marry the right person and find the right job. And adults with ADD often make the same mistake in both domains. They marry and work for a caricature of a bad fifth grade school teacher. They marry and work for someone who is controlling, demeaning, picking, and someone who doesn't really like them all that much, because they got the idea around about fifth grade that that's what they needed, that they were a hopeless case. So they had to be ridden herd on, they had to be controlled, they had to be demeaned and put down, and so on and so forth. So don't do that. Marry someone who loves you. Marry someone who loves your upside and is willing to help you with your downside. Okay, having said that, the tremendous good news is if you get the diagnosis and you get proper treatment, not only can you avoid all those disasters, you can achieve spectacular success.
We also know for sure that this disorder, when looked after, can make someone very functional.
I mean, you can be at the absolute pinnacle, not only in terms of success, but happiness, fulfillment, a rich and wonderful life. The key to it all is education, what you're doing right now. Once you get a handle on it, all the negatives can be turned around, and you can become phenomenally successful. So don't be afraid of getting the diagnosis. The only time to be afraid is when you don't know what's going on. By far, the most common reaction when someone gets this diagnosis is relief, then a feeling of anger, why didn't someone tell me sooner? A feeling of sadness, all these opportunities I've missed. You let out the anger, you let out the sadness, and then you jump on this wave of enthusiasm and excitement. Now, have I had to learn strategies to deal with the downside? Sure. But those are learnable. Whereas the upside is not buyable or teachable or procurable in any way. All of those kind of qualities, the charisma that are so commonly associated with children and adults with ADD, those can't be taught or taught. I really think it's important to embrace a strength-based approach that does not in any way deny there is a downside, but that emphasizes the positive as a way of developing the positive. People with ADD focus in a crisis. They're calm, cool, and collected in a crisis.
Paramedics, firefighters, emergency room physicians.
A brain surgeon, an airline pilot, don't worry, they pay attention when they're flying. They just have trouble with the paperwork after they've landed. Remember, embedded in impulsivity is a positive, which is creativity. You can't be creative if you're not a little bit disinhibited, if you're not a little bit impulsive. Get up off the couch. Don't look for the quick fix, the quick slogan, okay, I'll do that tomorrow. Read the book. Do the homework. The stakes are high. We're talking about your child's health and your health in the case of adults. There are many myths about ADD, and I think maybe that's the scariest, is that there are so many. What's unfortunate about the medications that we use to treat ADD is people don't realize how safe they are. It's a real failure of public education. The fact is, stimulant medication has been in use to treat what we now call ADD since 1937. Nothing lasts that long in the realm of pharmacology unless it is both safe and effective. Stimulant medication, when used properly, is safer than aspirin. Every year, aspirin kills tens of thousands of people due to GI bleeds and strokes. Hundreds of people commit suicide with aspirin. None of that happens with stimulants. The side effects are immediately reversible by discontinuing the medication. The real side effects people ought to be worried about are the side effects of not getting proper treatment. Years of underachievement, years of frustration, years of failure, years of into adulthood of lost jobs and failed relationships. Those are pretty severe side effects. So the good news is these medications used properly are safe and effective. The bad news is most people don't know that, and so they fear them.
Okay.
That was Dr. Hallowell. He's the father of ADHD. The best book to read is Delivered from Distraction, and he's the guru. He's ADHD himself and dyslexic, and we train under him. And he's explaining that chronic unexplained underachievement, your son, your brother, your father, anybody that's repeatedly doing all sorts of kinds of work and not getting anywhere, look for ADHD. And it can be diagnosed, it can be assessed, and there's various myths, including about medication. And he told you about the safety, and this is how ADHD is going. Let's look at the strength of these kids and these adults, and let's bring out the best from them and give them the best treatment. I think we'll get on to questions now.
Yeah, we'll open the lines up for questions now, so please feel free to call in to the viewers out there to ask any questions or any comments directed at Dr. Jeewa. The number is 011 086 7700 or 1 or 2 or 3.
Okay, we'll wait for the questions. So you can see the safety of the medications, and you can see we'll spend a few minutes until the phone calls come in about holistic treatment. If you have no money and you can't afford it, SARS has made it an official disability, so you can deduct it. There's a tax deduction for that. Further, we have a program at our office where we go to various schools to give them a free talk for the parents and teachers in the evenings, about 90 minutes to 2 hours on ADHD. It's similar to this, but more in detail. And lastly, we do various workshops. And please send us your questions, otherwise I'll go into a few more things.
Yeah, Dr. Jeewa, you mentioned something about the restlessness and adrenaline rush. We see that with your adolescents and adults. Can you comment on that briefly, please?
Yeah, the adrenaline is the dopamine and norepinephrine. So dopamine works on the pleasure center of the brain. So whenever you feel listless, you feel bored, you feel tired, you feel and depressed, you want something to feel lekker. And Hallowell calls it the itch. He said we ADHD have the itch, and it's the way you scratch this itch. The healthy way of scratching the itch is creating something, have a connection with a family, a spouse or something, or do exercise. The unhealthy way of scratching these itches is chocolate, coffee, Coke, Red Bull, drugs, alcohol, Tiger Woods, SEX, cyber addiction. Cyber addiction is a big problem. PlayStation, Game Boy, TV, laptops, all that. This is the biggest problem in ADHD kids. It fries the brain, and they found a condition called digital dementia. This German thing is irreversible. So these are some of the things that we have to watch out for.
Thank you, Dr. Jeewa. We have a caller on the line. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello? Can you please speak louder? We cannot hear you. Hello, assalamu alaikum. Wa alaikum salam. If your TV is on, can you switch it off so that Dr. Jeewa can hear your question, please, sister?
My TV is not on.
Okay, but can you speak louder because the sound is not coming clearly through?
Okay.
That's better.
I have two questions. The first one is, what are the known side effects on Concerta if someone drinks for ADHD? And what can you do to lessen the dose of medication?
What is the known side effects of Concerta, and what can you do to lessen the medication? Right? There's a question, correct?
I will listen on this.
Is that the question? How to lessen the side effects and how to reduce the medication?
That's correct.
Okay.
Yes.
Now, all the stimulants, Concerta and Ritalin is the same drug, identically inside. The release is different. The Concerta is smooth and long. The Ritalin is more aggressive. The main side effect is headaches, appetite suppression, and insomnia. If you have headaches, then you take Panado or something for a week, it should go away. I don't know what side effect you're talking about, but most of our kids that we treat, we give them some brakes for the Ferrari, because we say Ferrari brain and bicycle brakes. The brakes are Epilim and Risperdal. The side effect of Risperdal is sleep and gaining weight. The side effect of stimulants, including Concerta, is losing weight and not sleeping, so it balances out. So I don't know if that's the side effect you're talking about. Okay. Secondly, why would you want to reduce the dose? I don't know. It doesn't mean you give him a higher dose, he's more sick. In the olden days, you should go so many milligrams for such a weight of a child. Now it's not like that. These medications, you do not develop tolerance. It's dependent on dopamine and norepinephrine in the brain that you cannot measure. There's some parents, adults, that take a lower dose than their children because the metabolism of the kids are faster. There's no addiction. You can, some parents stop it over the weekend, start it on Monday. So there's no addiction, there's no tolerance, and there's no reason to stop it. We go as high as we can go until the patient feels better or it gets worse. When it gets worse, we come backwards to the right dose. So there's no, I don't see why you want to reduce the dose. Your doctor, work with your doctor, work with your school. If it's a child, we have a form that we send to the school every month, and the teachers fill in how he's responding. And we can see month to month what's going wrong. Okay. If it's too strong, we decrease it. If it's too weak, we increase it. Okay. If it's too much side effect, we stop it.
Right. Thank you, Dr. Jeewa. Shukran. We have another caller on the line. Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah, brother. Can you direct your question to Dr. Jeewa, please? Can you speak louder? The sound is not coming through clearly.
I said, firstly, I would like to thank the doctor for the brilliant show.
Thank you.
I'm calling from Durban. I've discovered my son at ADHD around the age of 5. And we've done all the steps through all the processes, moved him from mainstream school to remedial school. Can you hear me, Doc?
Yes.
He said from a mainstream to
remedial. Yes, go ahead.
And he's obviously 9 now, so it's like 4 years later, and he's on little at this moment. 10 milligram long acting, which carried him through about 2 o'clock in the afternoon. But what we noticed about his behavior, it hasn't come right, was, I mean, cries, and he's stubborn, and he acts a bit childish now and then. So I just don't know, at what age do you think he will actually grow out of this?
Well, he won't go out of it, but let me explain a few things. You are quite soft, but I think I got it right. He was diagnosed at 5, he's on Ritalin 10 milligrams. The maximum dose of Ritalin in a child at one time is 60 milligrams. So you can see he's growing and the dose is not right. It's got nothing to do with weight and size. Secondly, the Ritalin or stimulant helps focus, doesn't help behavior. So if he's moody, if he's angry, if he's shouting and he's screaming and he's difficult, that won't help it. You need to put in brakes. The Ritalin only helps retention and super focus. Does not help that behavior that you think is going to outgrow it. On the contrary, as he gets towards adolescence, it will get worse. So you need more than Ritalin. You need to put some honey. Take out the vinegar and put in honey, which is a form of different kinds of medication. So that's what we do. 10 milligrams for a guy with behavior is not enough.
Has that answered your question, brother?
Thank you.
Welcome.
Thank you. So I mean, like, what's the next stage you suggest?
Well, take him back to his doctor and tell him that his behavior, what's wrong with his behavior, he might have opposition defiant disorder, which 70% of the ADHD kids have. And the treatment is not Ritalin Concerta. That you stay with it and increase the dose maybe, but you might need some Epilim and Risperdal. Every child is different. So talk to your doctor, and if you have a problem, then you can contact us. And I'm sure your doctor can talk to us, but we'd gladly help you. But this is very easy, and it's not going to grow out of it. No. On the contrary, when the hormones come and the girls look at him, it will get worse.
Okay.
Thank you.
Right. Dr. Jeewa, you mentioned about the hormones, and we're obviously looking at the pre-pubescent, pubescent phase and management there. Now, earlier on in the show, you mentioned something about coaching. How do you think coaching can assist your adolescent child and prepubescent child?
Okay, great question. Last week I had a lovely Indian girl that was 17, adolescent, and she says, my mother's with me all the time, I can't date, I don't know how to talk to boys, I'm very scared, I'm very shy. My mother's everywhere, she's even in the session, can you not send her out, like I just got a mother went to the washroom for a few minutes. So she wants to be independent, she wants to socialize, she wants to learn how to talk to boys or guys of the opposite sex. She's already very bright and already in first year college. So the coach comes in, coach helps you, your skills, what are your strengths, what are your weaknesses, how to get independent, how to fit into your life later on, where you're going to fall off, what is the family history, what goes wrong in the family. The parents and the doctor cannot be the coach. We criticize. The parent says, your marks are bad, your marks are bad. We are brought up in a CDE environment, criticizing, demanding, expecting. That what parents do, leading to low self-esteem. The doctor says, you didn't take your medication, you didn't take your medication. So that doesn't work. A coach is a neutral person that the child or adolescent forms a relationship which helps this child during adolescence, during these hard pubescent times. During adolescence, the toughest time for ADHD is adolescence. The hormones are jumping, the marks are hard, the teachers give the kids independence that might not be ready, and the ADHD kids are about 3 years more EQ-wise immature than their counterparts. So we only mature by the age of 16, so we are 3 years behind all the time. Not IQ, EQ. So this gets them into a lot of trouble.
Okay, we have another call on the line. Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah, brother. Can you direct your question to Dr. Jeewa, please?
Dr. Jeewa, I was diagnosed with adult ADHD when I was about 28. I am now 30, and I was given a chemical called Psychiatrist, and I have stopped it. What do you think I should do? Should I carry on, or do I have to stop?
Well, it depends what are your main symptoms. Statera is a medium drug that takes 2 months to work, so most times the patients feel it's not working and the dose is not adequate. You need 1.4 to 1.8 milligram per kg. And the dose for adults at the right dose is 100 milligrams a day, and most doctors are afraid to give that dose. It's not dangerous, but it's a very slow moving drug. It depends what your symptoms were. You might need the whole caboodle, you might need the brakes, you might need super focus and Statera.
I was skipping jobs, basically not coming right at school, like you couldn't study at university.
Yeah, well, Statera works mainly on norepinephrine, and the main thing for focus is dopamine. So it has very little dopamine, so it won't give you the focus that you had short at school and as you were growing up. So you can use Statera and Concerta together, and if you're having temper and impulsivity, you might need some breaks with it. It looks like a lot of medication, but it works. During the latter part of this year, around in October, November, we're getting a new medication into this country called Vyvanse, and it is a combination of so-called Concerta. It's an amphetamine and with a serotonin in it for anxiety. So we'll be using less and less medication. But if they need it, you need it. So your Statera 10 milligrams is a medium drug, and it's doing exactly what you're saying. So we don't get great results. In combination, you get superior results. In North America, 50% of the patients are using stimulants, 30% are using a combination of stimulants and Statera, and only 20% are using exclusively Statera. So it is a very simple, ordinary medium drug that I think should be relooked. Talk to your doctor again, or we can help you, whatever you like.
Dr. Jeewa, we're coming to the end of our show, so we can have your next video up for the viewers, and then we'll wrap up.
Thank you.
Early in our conversation, I asked Ned about a topic that a lot of people put off till the last possible moment, or will never even address at all: medication. Now, I know everybody's experience is different, but the confusion and the mythology seems to be universal, ubiquitous. It's everywhere, still. But then, hey, until I learned the facts and found out what was really involved, I assumed the worst, because that's what I've been told by people who didn't really know either.
Often people ask me, do I believe in Ritalin? And my answer is, it's not a religious principle. It's not a matter of, do I believe in it? It's a medication. It's like saying, do you believe in water? Well, yes, to drink, but not to, not to build my house with. Medication, when used properly, can be a godsend. When used improperly, can be dangerous. That's true of pretty much anything. I call myself a radical moderate. You know, when it comes to medication, I believe radically in preserving the moderate point of view, which says simply this: stimulant medication can be a godsend. Try it. If it helps you, keep taking it. If it doesn't help you, stop it. What could be simpler? You know, and yet we turn it into this hot button issue. It becomes like abortion or capital punishment. People write all these screeds and polemics on how dangerous, and in fact, it's safer than aspirin. If you snort it, that's dangerous. If you overdose, that can be dangerous. You know, if you sell it on the streets, that's not good. You know, but if you take it properly, and it allows you, much as eyeglasses allow you to focus so that you can function in school or in your career, I've seen thousands of times now people literally catapult from the bottom to the top in terms of school performance, career performance, and social relationships. So this medication, when used properly, is a tremendous benefit to many, many people. And it's a shame that it becomes politicized.
I think what I was most worried about with medication was I'd lose my creativity or they're going to make me an addict.
These meds are not addicting at all. The definition of an addiction is when you take it away, you go into withdrawal. Well, you can stop it on Friday and start it on Monday, as a lot of people do, and you don't go into withdrawal over the weekend. So it is certainly not addicting. And you do not develop tolerance. You don't require ever-increasing doses. It's an interesting medication. In fact, the dose is not even related to how big you are. It's related to brain receptor sites that we can't measure. So some little people need a huge dose and some huge people need a tiny dose. It's very idiosyncratic and hard to predict, but you don't develop tolerance. What does happen sometimes is it just sort of stops working. And what I found, what helps in those situations is simply stop it for 10 days and then restart it at the same dose, and it'll usually kick back in and be effective again. So don't fall into the trap of just increasing the dose. Stop it, even though you don't want to, and then start it again 10 days later, and it usually will start working again.
There's a lot of help, and if you need help, check our website. We've got a great website. Diagnose them, treat them, and things will get better. And I hope we get another show down the line where we can teach you holistic treatment. Thank you. Jazakallah. Assalamu alaikum.
I think I would like to take this opportunity, shukran Dr. Jeewa, for a most enlightening, informative and thought-provoking discussion. I think the viewers would definitely agree with a follow-up to this, because many people are sitting there who are left undiagnosed and are labeled and are suffering because of the misdiagnosis or not getting treatment. So shukran for that most informative presentation. As is customary, we would like to end with a verse from the Holy Quran. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والأسر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. صدق الله العظيم. And I would like to just inform the viewers about our IMA convention, which is the Islamic Medical Convention being held on the 25th and 26th at Birchwood. So for people that haven't registered, please, you are still given the opportunity to register. It's going to be a very informative convention and we welcome people. Assalamu alaikum wa rahmatullahi wa barakatuh.